So imagine that you're suffering from a terminal illness. Would you be able to bear through that pain? Would you want to die quickly and painlessly to end that suffering, or would you keep living life as long as possible with the limited time you have left and prolong that suffering? Many people would choose that first option and rather die quickly and painlessly. And people who go about this, they sort to euthanasia, or as many people would refer to as mercy killing or physician-assisted suicide. But unfortunately, that's not available anywhere, like everywhere, except Georgia in this country and some areas in Europe. So what I'd like to do today is to tell you what exactly euthanasia is, why it should be an option, the benefits of practicing euthanasia financially, and the solution of practicing euthanasia responsibly. So first, I'd like to talk about what euthanasia is and the classifications. Euthanasia is the practice of ending a life in a manner which relieves pain and suffering. So there are three classifications for euthanasia. First, there's voluntary, which is conducted with the consent of the patient through prescribed drugs or lethal injections. There's also non-voluntary, which is conducted where the consent of the patient is unavailable, such as if the patient was in a coma or in a vegetative state. There's also involuntary, conducted against the will of the patient, and that's where the morals usually get into, like, you know, stating that it's wrong. But yeah. So now that you know what euthanasia is and its classifications, I want to tell you why euthanasia should be legalized. I believe people should have the right to choose whether to live or die. If you have the right to live, you should normally have the right to die. I don't think that's up to the government to decide for us. It also helps the suffering of people who are terminally ill. Clinical professor of surgery from Yale School of Medicine, Sherwin Newland, is for euthanasia, and he said, if the prevention and relief of suffering are the aims of medical inventions and not only preservation of prolongation of life, it seems imperative to rethink our profession's reluctance to participate in euthanasia or even be present during an assisted suicide without legal guarantees of protection. In other words, he's saying that it's hypocritical to not legalize euthanasia, since medicine is to relieve pain and suffering, and euthanasia is just that. An example of where euthanasia should have been used is the case of Chantal Sabier. She's a French citizen, and she suffered from an uncommon malignant neoplasm of the nasal vault. It's basically a very uncommon disease. It caused inoperable tumors to grow in her nasal passages and, you know, just spread along her face. It distorted her face, like around her eye area, and to a point where her eye actually did kind of pop out. So from that, she suffered from blindness, and not only was she blind, she was unable to taste or smell. So obviously you would be in a lot of pain from that. So she requested doctors to help her end her life, but was denied quickly because of French laws prohibiting victims of terminal diseases from receiving euthanasia. In 2008, she was found dead, and obviously she probably died suffering. And what I personally think that euthanasia should have been provided to her, because she wouldn't have to go through all that torture. Basically, it's torture if you just like tell them to keep living, and it's painful. Also, public opinion is actually for legalized voluntary euthanasia. The statistics say as high as 82% were supporting voluntary euthanasia according to British Social Attitudes Report. The highest support came from individuals who have diseases and are dependent on life support machines. So now there are also benefits from legalizing euthanasia. Financial benefits come from the legalization. It frees up medical funds to help other people in need. Healthcare costs for a terminally ill or life support patients no longer needs to be an issue. For example, like if you give them euthanasia, then you don't have to keep providing funds for life support. So here's some ways to regulate euthanasia accordingly and responsibly if it were to be legalized. Always go by living will or next of kin. If you happen to fall into a coma or a vegetative state, then the doctors can go by living will, saying that you don't want to be living by life support machines. Or if you don't have a living will, your relatives, family or relatives can decide for you. If no relatives are there, then doctors should be educated enough to take the right action for that circumstance. And certain requirements in order to be euthanized can also be a way. The only state who has legalized euthanasia is Oregon, and Oregon's approach states that patients must be over the age of 18, must have 2 oral and 1 written request. Patient must be terminally ill with a life expectancy of less than 6 months. Prognosis must be confirmed by a second consultant physician. Both doctors must confirm that the patient does not have medical condition that impairs judgment. Patients must self-administer the lethal injection themselves. So about 30% of the patients who started that process died before it was actually complete. 19 of those patients who were given access to lethal medication decided not to use it at all. So it shows that if you go by this approach, then it's not necessarily going to be abused. So in conclusion, I've talked about why euthanasia should be legalized, how it is beneficial, and the solutions of proper regulation of euthanasia if it were to be legalized. I believe that if we have the right to live, then why not have the right to die? Thank you.
Well, Lisa, what did you think?
I thought it was good. It was an interesting topic. I think that she did very well, that her thesis was pretty clear, she gave a preview, and it was pretty well developed. And she did a good job on emotional appeals, and she was talking about that patient that died.
Okay. All right. All the organizational stuff was fine. The introduction is okay. The visualization that you have, though, in several places in the speech, you make an assertion about pain and suffering that needs some demonstration. A terminal illness doesn't automatically mean pain and suffering, and if there is pain and suffering, why is it that they aren't being treated for their pain and their suffering? Is the only treatment available that they die? That's the thing I think you need to show to develop a more value-based argument on this particular point. Now, if, for instance, if there is no alternative treatment and an earlier death would relieve it, then I think you've got a clearer argument as to why that value is justified. On the other hand, if, for instance, somebody has like the tumor that you're talking about, but they can be treated for their pain and still manage to function, then why do they need to have that? And I think that that's one of the things that gets left out. Now, there is this argument about right to die, and I like the the statement that you make that says, well, we've got a right to live, we ought to have the right to die, and I understand that. But then you make the argument that says that there would be cost savings from doing this, and to me that sounds like it goes from being a right to die to having a duty to die. Get out of the way because you're costing things too much money, and we ought to save ourselves some of this cash for people who are actually going to be around for a while. And I think that's perhaps a little bit harder for you to get people to be convinced of. When you introduce that argument, all of a sudden it's less about people's autonomy and their right to make decisions, and all of it becomes about, well, saving money. Well, the cheapest way is, why don't we just make everybody die at 60, and then we'll save a lot of money. And anybody who's got a problem, we'll get rid of them when they're born. Well, we'll be in great shape. Yeah, I think most people recognize that there are moral quandaries about that. The Oregon statement solution that you developed I thought was interesting. Sorry, let me stop.